Hello, I'm Sarah Hoover, and this is my presentation about the potential weight loss clinic at Mid-Michigan Health. Mid-Michigan Health is part of the U of M, which is the University of Michigan Health System, located in rural Michigan. The surrounding communities include Mount Pleasant and Midland, as well as many rural communities. There is a population of approximately 912,000 people, and it expands within 23 counties around these two major areas. Now, the potential weight loss clinic at Mid-Michigan Health will require lots of information in order to get it started. So I've completed this pestle analysis to help us decide if this is a good opportunity for the health system. The political aspects that affect this weight loss clinic include healthcare programs such as Medicare and Medicaid. Now, these programs have many requirements that affect reimbursement as well as legal aspects of healthcare. So things that we can bill for, things that we cannot, and requirements for the health system and taking care of the community. So Mid-Michigan must abide by the rules that Medicare and Medicaid, as well as the state and federal government, dictate in order to be in compliance with the law. The economic status of the community that Mid-Michigan serves will affect this clinic. As of now, Mid-Michigan has healthcare centers in Clare and Gratiot, as well as Midland and Gladwin, which are all areas located within Mid-Michigan. These communities are economically depressed and include many rural and impoverished areas. Obesity is directly related to a large amount of expense in the healthcare community. In 2008, obesity care costs are estimated to have been $147 billion. It's important that we examine the cost of this obesity epidemic in order to see that there is a great need in this community. Weight is important to the community's social aspects, as well as their health and personal well-being. Obesity is directly linked to mental illness and poor mental health and an overall lower quality of life for the community. Technology is important within this weight loss clinic because Mid-Michigan does use Epic, which is its EMR. Now, Epic will allow practitioners from Mid-Michigan as well as other healthcare providers from different hospital systems to share information. This communication between practitioners makes healthcare much more accessible to those who are seeing private practice or providers in a different healthcare network. That way they can comfortably share information with one another to serve their patients. Because this is a rural and very spread out community, the environment plays a particular role in the healthcare that's being provided to this community. This rural area does not have access to other weight loss clinics such as private medical weight loss facilities. So therefore, this would be the only weight loss clinic in the area providing these types of services. There is many barriers and challenges anytime you're starting a new project and this weight loss clinic is no exception. It'll be very expensive to get operational, and the health system will need to look at the potential competition. At this point in time, there are no other weight loss clinics in the area, but there is another large health system, McLaren Health, located in the same communities. Historically, McLaren has opened similar projects in Michigan in order to keep in direct competition with them. So Mid-Michigan needs to stay ahead of the competitor advantage by opening this center and serving the community in a timely fashion. As far as the expense goes, there will be many barriers. Fortunately, Mid-Michigan does have land in the community, which will eliminate some of the building expenses, and does have many practitioners already employed. Right now, there are about 75 million people in the United States trying to lose weight each year. This is a huge market, and the Mid-Michigan area is no exception to this. It is shown that individuals who have their physician support with their weight loss are able to lose double the amount of weight of those who do not. Therefore, a medical weight loss facility will provide opportunities that a non-medical weight loss type of facility would not, and help the patients in this community be more successful than they could otherwise be. A medically supervised weight loss clinic should be located in Midland or Mount Pleasant. This is a central location that within the communities that Mid-Michigan serves and is easily accessible by all the major roads in the area. It will fulfill a community need and improve the quality of life for some of those members of the community. The Affordable Care Act does dictate that insurers must pay for nutrition and weight screening services. So therefore, these would be billable services and would be financially beneficial to the health system. Also, by providing this service, it would be beneficial to the community as a whole. These services being covered under the insurance would help those financially at-risk patients who may not be able to afford these services out of pocket. The weight loss clinic will need to use a multidisciplinary approach, which will combine interventions from multiple disciplines such as nutritional services, physician services, diabetic educators, pharmacy, and other multidisciplinary teams. It's important that when these patients come into the clinic, they will be given goals that are obtainable, such as small goals like changing their diet and reaching smaller number weight loss targets. In order to do this, the clinic will see its patients weekly when available, and if weekly visits are not available due to the patient's transportation, living situation, etc., then telehealth may be utilized to reach these patients without them having to travel to the clinic. The weight loss clinic will also use pharmaceuticals. These pharmaceuticals are evidence-based and have been proven to help with successful long-term weight loss, but they can only be used with a doctor's prescription under a doctor's care due to the many side effects that some of these medications carry. This would be a safe way for practitioners to prescribe these medications in a well-monitored type setting. Evidence shows that the Mid-Michigan communities are in need of a medically supervised weight loss support, and this is an opportunity for the health system to serve its community as well as be very profitable. Though this is a large project undertaking, it will be successful for the patients that we serve as well as for our financial goals as an institution.